So our ordeal began summer 2014 when my son, soon after he turned 19, had a psychotic break. I took him to the emergency room. They told me, oh, it's a drug-induced psychosis because he had been smoking marijuana. I was like, yes, I can work with that. Took him home. 6 months later, I was like, no, this is not a drug-induced psychosis. So we went back, started seeking mental health services, and it took a good 8 weeks to even get in to see someone the first time. It's been a hell of a struggle. I try to be patient. I'm not a psychiatric nurse, and mental health was never anywhere in my horizon, not interested at all. So it's been all by force. So we tried, we battled, we begged, pleaded, appointments, had to wait at least 4 weeks, sometimes 8 weeks. He was forced into group therapy. He didn't do well with that. I begged, pleaded for one-on-one therapy. That was like pulling teeth. Finally, he started really going out of control. It was December 30th of 2016, and after he saw the therapist, he left the office. I found him the next day. He was wearing a T-shirt that he had worn to his appointment. That was bizarre. I took him straight to UCSF because I felt that I just couldn't deal with Kaiser and the lack of care at that point anymore. At that point, he was 5150'd. I called, left a message on the therapist voicemail. I imagine, she never got back to me. We never heard from anyone at that point because they're so understaffed. And I just wish that, Kaiser would definitely hire more therapists, more psychiatrists to provide proper care. Our experience at UCSF has been night and day. He has a pre-scheduled weekly appointment, same day, same time, every Monday, 11:30, to see the therapist. We see the psychiatrist once a month, pre-scheduled. I don't have to call and beg for an appointment. Whenever I call them, they respond to me immediately within 24 hours. I have had to pay for it out of pocket. I did request a referral to UCSF from Kaiser, but of course they denied it. They said they provide the services that we get at UCSF, which is absolutely not true. Our initial intake at UCSF was 2 hours long, and they absolutely involved the whole family, including my mother. And I didn't have to go through so much HIPAA, red tape stuff that we encountered here. It's been hell. It's been a living hell. That's all I can say, trying to get help at Kaiser. It's just way too long of a wait.
Thank you for sharing that. I know that's been incredibly difficult. I really appreciate you sharing that with us today.